So I'm going to share a few cases because it's a global. So we'll go to the key decision points are the very important, already been received that the open reduction is the important part of any fracture. Though it is subtrochanteric, is very, very important because the biomechanical forces are almost 10 times more than any other part of the body. And do not nail, my topic is only restricted to the nail because given, so I'm not going to talk about the plate. So reduction is very important. Decision is to have your rotation of the proximal fragment is rotated in all subtrochanteric fractures. You need to internal rotate and then make a entry point. Before that, you don't take any entry point. It should be lateral to the parallel to the lateral cortex. And in lateral view, it should be in a exactly center. So that guide wire level should be there. Then and then you can open up and then you can plan your nailing section. Okay. Now this is a 49-year male with accident. This was treated in our department with Dell next, and I was busy in some other. And then this was the patient came, and this was treated by like this. This is a subtrochanteric fracture with the reverse oblique type. And this is the second. They said it was very good on it was good on image. So when they want to post-op X-rays, they have taken. This is a situation because of the slippage of that reduction. This was in way back in 2009. So that time we were not doing any augmentation. This time, if this would have come today, I would have put a plate on the lateral side to prevent this. So that time, then again, then we take to the we need to change the nail, whether to add some implants and redo the whole thing and change it to the plate. But now after that, once we started, we reduced it again, and we used because of we can't change the implant because of the problem of finance. So already been taken for the second case. So all these, the fixation of the lesser trochanter on the around the subtrochanteric area is very important. So most of the time it is now the absolute stability or absolute stability, which is now crux of the success for the subtrochanteric area. All right, this was afterwards he has united well. The second, this was once massive injury to the, and this is a multifragmentary subtrochanteric fractures. And this is a CT scan. If you see the CT scan, it is not a fancy, it gives you the global view of the fracture area. Majority of the times you don't see the posterior medial aspect, what has happened to that. And that is the line where you have to reconstruct, and stability is very important for all these fragments because this is a massive injury. So it has got a different forces acting on the different muscles, and different muscles have pulled that fragment apart. Majority of the times the separation is more as compared to the injury. So the CT scan definitely helps you to give you a better planning of the thing. So what was the thing when I saw Dina was doing a nail plate combo for subtrochanteric fractures. So he used a nail just and a plate in locking plate. I did exactly the reverse way. I did a nail first, but I felt on table it is not stable at all in spite of having properly 2 screws gone in. So this was really needed something what is called the absolute stability, not the absolute stability, not the relative stability. Though it is a comminuted fragment, so everybody will think about the relative stability because of the pieces. But I felt on table when we checked the rotations on the fracture table, there is a slight movement on image. So I thought this is the fracture is going to trouble us in future. It's going to break the nail or something. And we did this, and if you see exactly what was suspected, it was gives a good callus in spite of having both combo implants. And this is a concept which is Cody Kojima is invented, that absolute stability may go into the issues of the subtrochanteric fractures. And because of the lockdown, he could not come. So he sent me the pictures. He's working in the farms, and he's okay, fine with the movements, and everything is fine. Another third case I want to have. This is a case which majority of the times requires open reduction. You don't try to burn your under image intensifier. This is the fracture. You never get a closed reduction in the majority of the times. So you need to have an open reduction, maybe a minimally open, and then what is your clamp assisted reduction, which is a very important aspect. And do not remove this clamp till you lock the last. So whenever I keep it all the time I keep it this clamp throughout, so that the reduction is not lost till the put a last screw. So once this is done, this is a Cyrus nail which gives you a multi-directional, multi-level fixation. And there is a rotational instability in such fractures which needs to be prevented at any cost. So we may have to put one anterior posterior, a latch screw in the so that it give you a stability for that fragment which is rotated externally, which majority of the times you require to have an open reduction. And once it is done, it is like almost like a primary healing, so it gives an excellent stability. And this is a function of the patient. So in conclusion, in a high subtrochanteric fracture, if long PFN Cyrus nail can be passed after reduction, the nail is the choice. A low subtroch is the nail again. But whenever there is a possibility, nowadays I don't use any DCS anymore, but most of the time I use a nail plate combo, which gives is a very good stability on the, especially in this load area where you expect some sort of complications, non-unions, very high rate of single plate, single implant. So you may be a choice to go into a combo type of fixation. The tip of the trochanter is the entry on the medial side, the Cyrus nail, the additional cerclage, a plate or a polar screw are very helpful. Do not hesitate to put any screw or a plate, which will give you almost like an assurance for the union of this devastated fracture, especially in younger patients. So we need to have only one surgery, so that gives an excellent stability. And we need to know and work on this absolute stability, which will become after few years of study. Thank you very much for your kind attention.